All right, everyone. My name is Michael Fensky, and this video is going to show over my second CJM for nurse 6976. So I will share my screen right here and pull up my CJM for us all to go through. So the date that I took care of this patient on was March 12th. She was a 69-year-old female, um, admitted from a wound preservation clinic with known osteomyelitis and a need for antibiotics. She had a right foot wound that had been worsening. Um, she had no allergies. She was a full code status. Consult providers included vascular surgery, hyperbaric wound care, and dietary. The admitting diagnosis was osteomyelitis, and a little bit of history regarding her HPI. The patient presented from the hospital to the hospital from a wound clinic for evaluation of a right foot ulcer, and had been sent to the hospital for worsening infection. Regarding some recent surgical history, the patient had a metatarsal amputation secondary to osteomyelitis, May 21st, 2024, of the right third toe. She was on Bactrim for 7 days following that amputation. The patient was seen about 7 months later on December 13th at the podiatry clinic after the wound had significantly dehisced the previous month. And at that time, she was instructed to apply iodine betadine over the wound and to cover with gauze. The patient denied any trauma or any significant event that caused the dehiscence. Earlier this month, the patient was seen again in the podiatry clinic, and it was determined at that time that she was going to be evaluated by vascular surgery after continued complaints of the right foot pain. The patient did say that she has custom diabetic footwear, but rarely wears it. Medical history included DVT, diabetes, and associated neuropathy, um, stroke, coronary artery disease, and hypertension. She drinks about 2 glasses of alcohol a week, no drug use. Here you can see her vitals. Um, Everything looked pretty good except for the blood pressure in the morning. As I will go through later, she was on several blood pressure pills, including a couple vasodilators. So that was not completely surprising to get there at 7 in the morning and see that. Um, she just did have surgery 2 days prior to um, me assuming her care, and she did have some pretty significant pain that she rated as an 8 out of 10. Um, and I will, when we get to the medications, I will go over what we had for her. Pretty standard height and weight. She was on the consistent carb diet for the diabetes. No PICC line despite the longer term antibiotics, which I thought was a little surprising, but yeah, QID blood sugars. We let her be up pretty independently, but when the IV pull was going, we did have her call. And here's some lab values. This is all pretty standard. pretty much everything was within the normal range or very close to it. Glucose is a little bit high, but and same with the A1C here. But the important, probably the most important thing that happened for this patient during her hospitalization was that on 410, again, the 2 days before I had her, she had what was called a femoral popliteal angiogram, and that involved revascularization of the superficial femoral and popliteal arteries with balloon angioplasty. So basically, they opened up a lot of those vessels that had not been getting blood and nutrients to her distal right foot and was causing that chronic osteomyelitis and the foot ulcers and the pain that she had been experiencing for quite some time. Another important part of her care was to begin hyperbaric wound care, um, and that was planned to start the day after I helped take care of her in the hospital. For drugs, she was on atorvastatin, cefepime, and vancomycin for antibiotics. Um, Pretty standard stuff to treat osteomyelitis. She had plenty of gabapentin. That was to help with her neuropathy. And then, in regards to that blood pressure I talked about earlier, she had Imdur, lisinopril, and ranolazine. And really, morphine is also a vasodilator, so that would help with blood pressure as well. Um, and yeah, I spoke about her pain earlier. I did have to give this twice during my shift, but she said that her pain did get significantly better after I gave that. Another new medication that I saw was called Prasugrel. I had never seen this before, but I looked up that it's commonly given after stent placement to prevent thrombotic events. And yeah, that makes sense considering what the patient just had. In terms of her exam, she had for neuro some right lower extremity weakness secondary to neuropathy, and the wound that was present. Just anterior breath sounds diminished. Um, we were encouraging the incentive spirometer, especially after the surgery. She did have a pacemaker, um, regular brain rhythm though. Uh, Diminished pulses in the upper and lower extremities. GI and GU were all good. Patient was having a bowel movement despite getting those opioids. And the big wound on her right foot. I got to see it up pretty close and uh, browsed through a chart to see how it had kind of worsened over time. Um, but yeah, it was interesting to see all that. And hopefully, what they all did for her during this hospitalization will be good. Um, so I wrote my pathophysiology about osteomyelitis. It's an infection of the bone that can be either acute or chronic, likely chronic in this case. Um, First, the pathogens enter the bone by continuous spread, or contiguous spread. Need to change that. Um, and at that point is when the pathogens spread to the nearby soft tissue and can enter the bone, and when the foot ulcer becomes infected. From there, the inflammatory response is initiated by neutrophil infiltration, followed by inflammation, swelling, um, and exudate. And that exudate um, can cause an increase in intraosseous pressure. And this can be very painful, and it can also compress on the nearby blood vessels, um, which ultimately had to do with the procedure that the patient underwent to get those um, leg vessels stented. Yeah, because those blood vessels um, being compressed can lead to ischemia and the tissue necrosis that was characteristic of the patient's feet and the ulcer that had developed there. In this patient's case, her history of hypertension and coronary artery disease likely had something to do with um, needing that revascularization of the lower extremity to restore blood flow. Um, for pertinent cues from histories, kind of just mentioned that diabetes, hypertension, coronary artery disease all likely played a part in this patient's diagnosis. Most pertinent vital sign was just the blood pressure. It did go down. I remember the second time I took it, I just didn't get it on this sheet. Um, but that was also pretty early in the morning. She hadn't had her meds yet. Um, so not super important, but something to watch. Most pertinent labs. If they was abnormal, it would probably be the white blood cells, but since those were normal, um, I just said the watching the glucose numbers and making sure that's well controlled, because that can help facilitate the wound healing. The most pertinent diagnostics were definitely that femoral popliteal angiogram that the patient underwent. Um, Obviously, a surgical intervention, and the nurse should be um, keen on assessing the surgical site and monitoring for changes like bleeding or hematoma. Then the most pertinent physical assessment finding, um, just watching that right foot, um, assessing for pulses, new signs of infection, increased pain, things like that. And here I wrote about the different drugs that she was taking, what their purpose was, the cefepime and vancomycins to treat the infection and provide antibiotic coverage after surgery. The Plastigral was to help avoid blood clot in the new stent. The Imdur was lisinopril, ranolazine, um, helping with the blood pressure, and then the gabapentin and morphine, helping with the pain related to the surgery and neuropathy. Um, for three priority provider orders, I wrote administer base dose and correctional insulin. Again, facilitates blood sugars, promotes the healing of the osteomyelitis. Perform wound care on that right foot daily. This can help the nurse get a better assessment of how the wound is doing, and can help facilitate further healing by cleaning and redressing the wound. And then administer IV antibiotics too, because this is really what's going to help to treat the infection and making sure no new infections come as a result as well. Um, Client is at risk for developing, or I guess needing, digit, or I suppose limb amputation, as evidenced by necrosis of tissue and distal bone. Um, Kind of already had this, but also at risk for developing chronic foot ulcer. It's evidenced by pretty similar to the last one, chronic ischemia. And then the most likely uh, um, thing that the patient was at risk for developing is sepsis. There wasn't a lot of emphasis to support this, but I did say that it was the most important because it is probably the most likely, and also most likely the most acutely dangerous or life-threatening. Um, for 5 appropriate nursing orders, I wrote monitor for signs of spreading infection, um, promote wound healing by optimizing blood glucose and performing wound care, assess perfusion and wound condition, assessing distal pulses, pain, capillary refill, and skin temperature, administering antibiotics to treat the osteomyelitis, and coordinating with the other disciplines like vascular surgery and the hyperbaric wound therapy can all help this patient um, meet and achieve her goals. Interprofessional healthcare members. I wrote the CNA can help with ADLs. PT can work with the patient in regards to being able to move safely and concerns that the patient might have when after being discharged home. And the hyperbaric wound care is a specialized discipline that can help in treating the patient's wound. For the final section here, there weren't really any interventions that were needed immediately. Probably the most timely interventions would be to deliver the antibiotics and to treat the patient's pain. Um, for delegation, I wrote the CNA can help with ADLs as well as taking vital signs and blood sugars. Um, Throughout the day, I collaborated with kind of what I set up here. My preceptor, Connor, um, physical therapy, and when I did bring the patient's morning medicine, I did interact with somebody from the hyperbaric wound care. Patient and family education, I wrote educating the patient on new signs of infection and completing all antibiotics, especially when she gets transitioned to oral. Performing wound care and the importance of wearing those diabetic specific shoes that she has, but says she doesn't wear. Healthy food options for regulation of blood sugar, and that proper follow-up with the appropriate health professionals. Um, can help this not get quite as out of hand as it did this time. These are all educational items worth noting. For safety, I think I just said this, I said it earlier. Patient was able to move okay with a cane by herself, but I did have her call when she was hooked up to the IV pole, like when she was getting those antibiotics. And then I wrote again pretty much what I wrote up there, what what each medication's purpose is and why she's getting it. Um, well, that's all, everybody. Thank you for listening, and take care.